Good evening and welcome. Hello, Robin. Welcome, darling. Welcome, Sarah. Hi, Jess. We've got Nargis. Would you like to say hello? Do you want to unmute and put your video on? Say hello.
Hi everyone.
Hi. How you doing? Where are you joining us from?
I'm in Arizona.
Beautiful. Tell me about Arizona. What is it like there?
Oh, it's beautiful right now. We're in the 60s and 70s and it's sunny. Right now it's a bit cloudy, but usually it's sunny and it's really good.
It's
This
temperate.
is the perfect time for Arizona, yeah.
It's a perfect time to make a baby.
I mean, yeah.
Wonderful. Well, look, Nargis, I want to welcome you. I'm going to make a start, ladies. So I'll get you to just unmute yourself. And at the end of the presentation, I'm going to try and keep the talk to about 30 minutes. Mute. Okay. All right. There we go. I'm going to make a start. So we're going to be talking about histamine and how it may be intolerance, histamine intolerance, how it may be blocking your fertility. So yeah, like I said, we'll stay to the end, and then we're going to have a Q&A, so you can bring your questions. Try not to put them in the chat. I feed off your faces and your voices. So by all means, just speak up and turn your video on, because I love to see you. All right, so we're going to be unraveling histamine's hidden role in fertility. And I think when we think about fertility, we often focus on hormones, we focus on egg quality and cycle tracking, but histamine sometimes can be that missing piece, and it's often overlooked. So it's well known for its role in allergies and the immune response, but histamine also, it directly influences ovulation, implantation, and even pregnancy outcomes. So what I find, if histamine levels are too high or they're poorly regulated, it can contribute to unexplained fertility, implantation failure, and miscarriage risks. So tonight I'm going to break it down. I'm going to break down how histamine affects your reproductive system, how, what signs we're looking for with histamine intolerance, and then what you can do to support your fertility. So let's dive in. So what is histamine and how does it affect your fertility? So if we look at histamine, it's a neurotransmitter and it's an immune messenger that plays a critical role in digestion, in inflammation and circulation. So it helps the body respond to stress. It helps the body respond to allergens and infections when histamine levels are too high or poorly regulated. But this is where the problem is. It can disrupt the hormones and fertility. So if we look at the receptors of histamine in our body, they're known as the H1 receptors. We've got 4 of them: H1, H2, H3, and H4. So the H1 receptors, they're found in the skin and the blood vessels. And so that affects, circulation, and you can have allergic reactions. The H2 receptors, they're found in the stomach and the intestines. And so this can control like your stomach acid and your digestive process. And we need those receptors strong especially for your microbiome, which is your estrobolome. Your H3 receptors are located in the brain and the nervous system. So this is where it can influence, things like sleep and mood and appetite. And then we've got the H4 receptors are found in the gut and the immune system and the reproductive organs, regulating inflammation. So one of the key features of histamine is that it dilates the blood vessels. So it helps the immune cells move quickly to fight infections. But it's when we have this excess histamine, it can trigger inflammation, especially, creating hormonal imbalances and creating allergic type reactions, which can impact the fertility. So if we look at it, histamine has a positive, role in fertility. It also has a negative impact. So we'll start with the positives first. I'm a positive person, so let's look at that. And it enhances blood flow. That's the first thing it does. So if we look at how it's shown to have these positive effects, it's vasodilating the blood vessels. So we're getting enhanced blood flow to the reproductive organs, which is what we want. So this is great for circulation, and it can help create that favorable environment for conception and implantation. It has a immune response regulation. So what that means is it helps, histamine can modulate the immune cells activity. And we need that to create an environment that's conducive for the acceptance of the fertilized egg. And we also like it for the uterine contractility. So, controlled uterine contractions are important for embryo implantation, and we need histamine through these receptors to contribute to maintain this. So we want it for the uterine tone, aiding in the attachment of the embryo to the uterine lining. Now, where we see the negative impacts of histamine, so, if we've got that excessive histamine response, so it can lead to inflammation and allergic responses in the body. So that can interfere with implantation. So then we've got the increased risk of miscarriage. We can then have that overactivity of the immune response, and it can, almost mistake the embryo as a foreign invader. So, this can contribute to, pregnancy complications like, chemical pregnancy. It can be, preterm labor. It can be things like preeclampsia or recurrent pregnancy loss, or even placental insufficiency. So, while histamine's role in vasodilation is beneficial, you can see excessive levels can also increase the vascular permeability. So this might create things like fluid accumulation and hamper the proper attachment of the embryo to the lining. So let's look at some of the symptoms. I think this is the big takeaway, because you want to be able to look, you want to be your own fertility detective. You want to be looking at what are some of the general symptoms we see. So, generally I'm looking at skin issues, respiratory issues, digestive issues when there's histamine things going on. They're the three big ones, but we're going to break down we'll go into it even deeper. So with skin issues, like things like eczema flare-ups, you might have hives or seasonal allergies, rashes, itching, flushing, or even tissue swelling. If we're looking at the respiratory system, it could be asthma or wheezing or sinus, sinus congestion or runny nose just for no reason, chest tightness, or even shortness of breath. You might have difficulty breathing. If we've got digestive issues, we've got things like leaky gut, Crohn's disease. It could be even just irritable bowel syndrome. There could be some gluten sensitivity like celiac, or even just little things, abdominal pain, cramps, bloating, heartburn, food allergies, diarrhea. Loose stools is a big thing that I see with histamine intolerance. And you could even have some nausea. But I think, some of the other things that I'll see is, chronic pain. You may have irritability. There can be issues around sleep. So, difficulty falling asleep, waking up, anxiety, just that restlessness with your sleep. Now, you could have arrhythmia. Now, this is an irregular heartbeat or even an accelerated heartbeat. You could have headaches and migraines, or hypertension, or, low blood pressure. Okay. You might have difficulty regulating your blood, pressure, or even difficulty regulating your body temperature. But in the reproductive system, what I tend to see is, you might be having recurrent pregnancy loss, unexplained infertility, or irregular menstrual cycles. You might be having PMS or estrogen dominance, and we're going to break all of this down. We're going to get into this. Increased pelvic pain, discomfort, or a heightened sensitivity in the pelvic region. And then you might have, a disruption to your cervical mucus production. So this can really affect the sperm movement and the journey of the fertilized egg. So I think recognizing some of these symptoms is crucial. And, because, it can signify that there's an imbalance going on in histamine levels, and that might be impacting your fertility and your reproductive health. So if we look at what causes excess histamine, so there's, can be attributed to several underlying factors. And I'm going to try and break it down, make it simple. But excess histamine is often attributed to, it's an enzyme deficiency, and it's specifically a deficiency of the diamine oxidase enzyme. We're going to break it down into DAO, diamine oxidase enzyme deficiency. Now, what this enzyme does is it breaks down histamine in the digestive tract. So it's like the Tao or the way, So I want you to think of we're going to call it the DAO or the Tao, diamine oxidase. Just know it's an enzyme that breaks down histamine. And I'm just relating it to Chinese medicine. I'm calling it the way, the Tao, right? And we need it to, break it down in the digestive tract. So when we have that altered Tao enzyme production, it can be due to, you may have SIBO going on. you may have nutrient deficiencies from, this enzyme deficiency. It could be a leaky gut. It can be genetic morphisms. And this is like the MTHFR, and this can be the DAO gene variants, okay? And we'll get into testing, but you could be, medications. So if you're taking non-steroidal anti-inflammatories, antidepressants, antihistamine, you could even be taking histamine blockers, right, like Zantac, and this can alter that DAO enzyme production. Now, additionally, certain foods that can, that are high in histamine, such as, aged cheeses, processed meats, and fermented foods. And, this can contribute to an influx of histamine. Now, I often recommend fermented foods for fertility, but if you're reacting to, like, sauerkraut, and you have some sauerkraut and all of a sudden you get your facial flushing, this is a big, light bulb moment. I might have an issue with histamine. All right. So if you're doing like I have all my patients doing apple cider vinegar with some lemon water first thing in the morning to work on the gut enzymes. Now, if you're getting facial flushing and, all of a sudden loose stool, you might have an issue with those fermented things like apple cider vinegar. All right. And that could be a key sign. Oh, maybe I need to do some testing of my histamine. All right. So not all fertility foods are great if you have histamine issues. So this is the key markers, if you're reacting to things, especially when you do, some of these foods that are high in histamine, it's a key indicator that you might have an issue with histamine. So you can have hormonal fluctuations, particularly excess estrogen. Now, this can trigger histamine production just in some individuals, not everybody. Now, what happens, because estrogen stimulates mast cells to release more histamine, it then reduces that activity of the diamine oxidase enzyme, which means that excess estrogen and histamine can disrupt your ovulation and implantation. We can also have histamine-induced inflammation, which can, worsen endometriosis, or if you've got PCOS, or if you've got the recurrent miscarriage issues. And women that have that high estrogen dominance often feel worse around ovulation due to the high histamine spikes, because estrogen rises just before you ovulate. So if you're feeling that you're getting that, that high histamine spike, it could be related to the histamine issue, especially with the estrogen rising. And we've got to recognize, these potential causes because it's essential for addressing the issues and taking steps to achieve better histamine balance. So if we look at some of the diagnostics for testing for histamine intolerance, so, those key things of looking at foods is a great thing. But then if we look at tests, tests to prioritize for your fertility and histamine balance, we've got the DAO enzyme. It's an activity test. And there's a plasma histamine test. So this measures histamine levels in the blood and how well your body's breaking down the histamine. So if you've got the low DAO activity and high histamine, it suggests that you've got histamine intolerance. So that makes sense, doesn't it? So that can be contributing to your implantation failure, or, increased inflammation or excess mucus. We've also got the ratio of your progesterone to estradiol. So you want to be checking that, checking the estrogen histamine connection, because estrogen increases histamine production, while progesterone, it stabilizes the mast cells. Is there high estrogen to low progesterone ratio? It can create fertility issues, and we want to see that. So, we want to check against that. So that's another marker, always checking the ratio of estrogen to progesterone. Because, if you've got the high estrogen to low progesterone ratio, you can have PMS, you can have heavy periods, you can have recurrent pregnancy loss, because we need that ratio balanced. All right. And we don't want to increase the histamine. So other tests, we've got the AIBA test. This is the Advanced Intestinal Barrier Assessment. This tests your gut health and histamine metabolism. So again, it's looking at the DAO histamine ratio. It evaluates whether histamine is being cleared efficiently. It tests your zonulin levels. So high levels of zonulin, it indicates leaky gut. which allows for toxin and inflammatory cytokine molecules into the bloodstream, affecting egg quality and implantation. And then it's the LPS. This is the lipopolysaccharides test. So this is included in the AIBA testing. And so, when you have the LPS, you've got systemic inflammation. So you'll often see the high LPS markers with endometriosis. And this can affect implantation and your potential fertility. Other tests, GI map testing, or the stool testing, and this identifies gut imbalances, bacterial overgrowth or dysbiosis, and this may be reducing that DAO enzyme, all right, so production, and increasing that histamine overload, all right, so that's another thing. And then lastly, genetic testing. So this is the DAO, the HNMT, the COMT, the COMT, or your MTHFR. So the DAO and the HNMT genes, they impact how efficiently histamine is broken down. Your COMT gene affects estrogen metabolism and histamine clearance. And then if you look at the MTHFR gene, it influences methylation. So this is essential for your estrogen detox. So this is where you can be getting estrogen dominance, and it can be affecting, your egg quality and your folate levels, your ability to methylate folate. So these are all helpful if you've got hormonal imbalances, specifically if you've got recurrent pregnancy loss or unexplained, might go down the gene testing path. But let's break it down simply. So, looking at histamine-rich foods, these are to avoid if you're noticing some of those symptoms of, histamine intolerance. So aged cheeses, I've mentioned those. So this is, cheddar, Parmesan, the Gouda, and the blue cheese. It can be kefir and yogurts, sauerkraut, as I mentioned, kimchi and pickles, even though I use them in my fertility protocols. But if you've got histamine issues, we want to take these out because they're high in histamines. But miso, tempeh, soy sauce, clearly we're off alcohol, but, I'm just going to mention it, wine and beer. Kombucha is another one. Like I see a lot of people that drink a lot of kombucha because it's like with sugar-free kombucha and everyone's on it. But if you've got issues with histamine intolerance, kombucha is out. Yeah, get it out. All right. The cured and processed meats. So this is your salamis, your pepperonis, your prosciutto, your santagnelli, which I love. It's terrible, isn't it? We start to look at it because sometimes I look at things and then I'm like, do I have histamine intolerance? I think I do, because I do get some flushing and I do get some, when I eat certain things, I can notice the side effects with these high histamine foods. So, if we look at seafood, what's high histamine seafood? You'll see this with eczema and allergies. We stay off shellfish. So shrimp, crab, lobster, mussels, oysters. Like I recently just had a patient and he's just been on a cruise and he's been having all the histamine triggers with all the seafood. And I'm just like, dude, we've got to get off the shellfish. And he's going on a cruise in 2 more weeks. And I'm like, we need to eliminate the shellfish. He knows this, but it's we go on holidays and we get all cheeky sneaky and we forget all of this, but it's about remembering. All right, so vegetables that trigger histamine release: tomato, spinach, eggplant, and avocados even. And I love avocados, they're good fats, but if you're having issues with histamine intolerance, you might want to just reduce that and find alternatives. Citrus fruits that are high in histamine, we've got oranges, the citrus things, lemons, limes, grapefruits, strawberries, pineapples, bananas. If we're looking at nuts and legumes, then it's walnuts and cashews. Peanuts that's a given. Chickpeas, lentils, soybeans. But if the beverages, I think it's just the beer, wine, champagne, they're out. With histamine response. If you look at champagne, I love champagne, but it's injected with yeast. So it's like creates that histamine response. I'm sorry, ladies, if you are doing a little cheeky 1 glass of champagne and you've got histamine intolerance, you need to let it go. But if we want to look at, foods that are in. So we want to look at foods that contain natural histamine blockers. So, quercetin-rich fruits and veggies. So what this means is these are your natural antihistamines. So apples, especially the red varieties, all your berries are in, Beautiful. Can't lose the berries. Red onions, broccoli, capers, kale. All right, but saute the kale. Often, raw kale is very cold and raw. So infertility, we want to make sure we saute it, steam it, blanch it, so we want it cooked. Kale is king when it's cooked. Other foods that support that DAO enzyme and histamine breakdown. And this is all the reminders of all the good fertility friendly foods. So grass-fed meats, lamb, beef, chicken, turkey, wild fish, salmon, cod, eggs are in. Bone broth is the fertility elixir of life, and all your fresh herbs like rosemary, thyme, oregano, origine, just however you want to say it. But foods that reduce inflammation and support your fertility, all your leafy greens, so arugula or rocket, watercress, Swiss chard. If you haven't tried these things, give them a go. Get into your leafy greens because it also helps with detoxification. And we need liver detoxification to escort estrogen out of the body. Sweet potatoes, I always say the kumara, the sweet variety, sweet potatoes is king in fertility. It's so good. Beets. And then if we're looking at oils, especially if we're taking out avocados, what can we add in? Olive oil, coconut oil, even sesame, all right? And then your gut healing and probiotic friendly foods. So coconut yogurt, no additives. This has been something that I've implemented, and it's been amazing to go from, dairy-based yogurt and kefir to a fresh coconut yogurt. It's really nice. But everything lightly cooked. In fertility, we want lightly cooked, steamed or roasted veg. Aloe vera, it's good because it works on those mucous membranes. So, I had one patient, she had SIBO. We were working on her histamine intolerance. We worked out that histamine was the key thing that we'd missed. And what we did, instead of her having the apple cider vinegar in her lemon water first thing in the morning, what we did is we added in 2 tablespoons of aloe vera juice. And, she's still got the benefit of having the morning drink with the lemon and the aloe vera, but we took away the ferment of the apple cider vinegar. So apple cider vinegar is not for everyone, especially if you have histamine intolerance. So this list will keep you, fertility friendly and balanced and reduce, histamine-related inflammation if you do have some of those symptoms. Lifestyle modification. So, stress is certainly linked to histamine release. The more stressed you are. So we want to think of, and this is important for fertility, stress reduction is essential. And these techniques, it can be yoga, meditation, Pilates, anything that's going to help you breathe properly. So deep belly breathing is fantastic. Lower diaphragmatic breathing. I often get patients to do one hand on the heart, one hand on the womb space. And what we're doing, and we're just moving the belly. We keep the chest still, all right? We keep the heart space still, and we just move the lower belly, all right? Let it rise and fall into the hand or excavate to the spine. And it's that way you're using your diaphragm. It helps maintain a more balanced histamine level when you're de-stressed, lowers cortisol. The moment you do that deep breathing. What else? Okay, we want to reduce, histamine-producing pathogens in the home. So, certain pathogens like bacteria, viruses, if you've got mold toxicity, we want these all stimulate histamine responses in the body. So through testing, you might need to get a mold expert in. If you can see the mold on your walls, then it's pumping out this neurotoxin and your histamine level is going to be through the roof. All right, so look around, look at your environment and, look at reducing that toxin load. So from a Chinese medicine perspective, how do we look at this? From a TCM, I remember I'm a doctor of Chinese medicine. I'm always going to be looking at through the lens of Chinese medicine. So I'll often see liver qi stagnation. And what we mean by this in Chinese medicine, the liver is involved in how energy moves through your body. So since emotional stress can trigger histamine response, we want to support the liver and the liver energy in Chinese medicine. So acupuncture is great for supporting the liver. And I love this point, liver 3. All right, it's known as the supreme surge. And it's literally between the big toe and the second toe. It's wonderful for moving the liver flow, reducing emotional stress that may trigger that histamine response. we'll often see things like spleen Qi and lung Qi deficiency. So this is where you might be having chronic allergies and that histamine intolerance, or recurrent infections, or, you know, allergies, eczema flare-ups, rashes. So, you know, in Chinese medicine, we use formulas like Yu Ping Feng San. This is known as the Jade Windscreen formula. It strengthens the Wei Qi. This is your defensive energy. So it's good for those chronic allergies, runny nose, congestion, histamine intolerance, and immune system dysfunction affecting implantation. So if I'm using a point to go with that, it would be Hegu. This is the headache point. You'll probably all know this point. This large intestine 4 or colon 4. All right, it clears heat, it regulates the immune response and reduces allergic reactions. So already you can start palpating these points. Large intestine 4, liver 3, and they're known as the 4 gates. So bilaterally, when you use right and left, large intestine 4, liver 3, right and left, it really supports your immunity. It really supports that histamine intolerance. And then if I was going to throw in a third acupuncture point, I love this point, large intestine 11. If you bend your elbow here, bend it, all right, and you'll see that there's a pool at the bend, we call it, pool at the bend, large intestine 11. All right, you follow the cubital crease across here, and where that crease ends, it falls into a pool, right? You see how I'm pressing into that? Now, massage that point, all right? This reduces itching and rashes and the swelling and that inflammatory skin condition that we get. So I love using this for eczema and skin conditions and irritation. Okay, so Chinese medicine has a plethora and wealth of formulas and points that we can use on the body for histamine intolerance and supporting your fertility. If we look at some of the supplements now, I think all of us are wanting to know, what supplements can I use for histamine intolerance? So, and supporting your fertility. So if we look at a DAO enzyme support, so this is sometimes, you know, if I'm using Metagenics, I might use Digestex. If I'm, you know, sometimes Seeking Health is another product called Histamine Digest. Digest Zymes, Herbs of Gold, this is another product. But it's literally using these enzymes, all right, before meals, taken before meals, helps break down the histamine in your food. And it's useful when you do have that low DAO activity or gut-related histamine response. And then things like vitamin B6 required, especially if, you know, we need this for the DAO enzyme production. So it also supports progesterone synthesis. So it also balances estrogen and progesterone, vitamin B6. So especially if you've got PMS, so vitamin B6. Copper, if you are deficient, it's not supplemental for everybody. But if you've got things like MTHFR gene mutation or the DAO or the CONT gene, all right, you want to look at methylated vitamins, especially your B vitamins. This is B12, your folate. Make sure that it's not folic acid, it's folate. So this is your L-methylfolate or MTHF or levomethylfolate or folinic acid. All right, these are the safer MTHFR safe forms. And then it's supporting the histamine breakdown via methylation. All right, and it's crucial for your estrogen metabolism and implantation support. If you've got methylation issues going on and estrogen detox issues, then I might add in N-acetylcysteine, or otherwise known as NAC, around 600 to 1200 milligrams a day, because it increases glutathione, which is the master antioxidant. It aids in that histamine clearance and fertility detox pathways. I might add in something like calcium deglucarate, anywhere from 5 to 1,000 milligrams a day. It supports liver detox of estrogen. It prevents that estrogen-driven histamine surges. Okay, I love calcium deglucarate because it doesn't tank your estrogen levels like diindolimethane. So I'm always going to choose calcium deglucarate over DIM because we want to always maintain your estrogen levels. And when you take DIM, it can really lower your estrogen levels quickly. So you've got to be careful. Like, you know, if you do have some estrogen dominance, I think everyone just thinks, I'm going in for the DIM. I'm going DIM. Go the calcium deglucarate because it will do it gently. And that way you can control it and monitor it more safely. If we're looking at more natural antihistamine and inflammation reduction, so, you know, quercetin, vitamin C. It could be, and omega-3s. If we're looking at gut health and histamine breakdown in the digestive system, clearly probiotics. But we want to have the histamine safe strain. So we want to avoid the high histamine strains like Lactobacillus casei and the Bulgaricarius. We want to look at the histamine, the best strains for histamine intolerance, which is Bifidobacterium infantis, Bifidobacterium longum, and the Lactobacillus rhamnosus. All right, so they're the probiotics that are histamine safe. Okay, L-glutamine also is great for the gut. So if you've got leaky gut and gut issues that can worsen, it's going to worsen the histamine buildup and inflammation. So L-glutamine is such a great thing because it supports that intestinal barrier integrity, improving the DAO enzyme activity production. And then, digestive enzymes, I've mentioned those. Omega-3s, I've mentioned those. Beautiful. Okay, we have done this in 30 minutes, ladies. I'm so happy about this. So just to conclude and wrap up, I want you to think of, could it be histamine playing a factor in this fertility puzzle, right? If things are not happening or moving quickly or swiftly, or you've got recurrent pregnancy loss or implantation failure going on with IVF, or uterine, receptivity issues. It could be that excess histamine could be the hidden barrier. All right. And I want you to explore that with some of this testing, or look at some of your symptoms and reducing some of the foods and the overload. And, I think just by addressing diet, the enzyme function, the gut integrity, even your stress levels, by adopting even just some lower diaphragmatic breathing, reducing that overall inflammation, we can create an environment that supports conception, your pregnancy maintenance, and a healthy baby. So if you have been struggling, it could be the missing piece. And I just want you to maybe put your laser focus on histamine intolerance, because with the right testing, with personalized nutrition and supplements and holistic strategies, you can restore the balance. You can always restore the balance and optimize your body for pregnancy success. So thank you for joining me, ladies. I am going to open up the Q&A now. So is there any questions that you may have for me? Please unmute yourself. Nargis, do you have any key questions, or is there any key takeaways that you may have learned or loved?
Yeah, it all, kind of like fits in. Like, we talked about skin issues, and I was just thinking about myself. I don't have a lot of skin issues, but I did have like a series of hives back in 2016 out of nowhere, and then also I do have breakouts on my face. It usually seems like a certain food that triggers it, but it happens that,
Where are the breakouts? Are they on the cheeks or on the jawline? Where are they normally?
they move. Like they used to be, like when I was a teenager, they used to be in the forehead. They never stopped, but now, like, right now I have a few down here.
Okay.
And then here.
Yep. So the jawline relates to the liver. Okay. The cheeks are definitely the gut. This is the stomach meridian in Chinese medicine. So it could be that we need just a little bit of gut support for you.
Mm-hmm.
Yeah.
And liver support.
And liver support and gut support. So it could be, all right, maybe I'll take some N-acetylcysteine, or can I do some, gut support in terms of sweet potato, or looking at those positive strains of, of probiotic that support your gut, or even just some aloe vera juice for the gut lining, for that integrity of the gut. Yeah, you've unmuted. There we go.
Oh, yes. And then also I realized that I might have some type, like, a gluten sensitivity. I when I stop gluten, I usually have like this lower back pain, and when I stop gluten, it just goes away. It's really weird.
Okay.
And I have sensitivity. You were talking about pelvic pain or sensitivity in that area. I have IC, which is sensitive bladder, kind
Yes.
of type, so I have to stay away from certain food, like
Yes.
coffee irritates my bladder.
Yes.
So I do have a lot of those symptoms that you were talking, and I know it's all related. Um, I realized that I may have some methylation issues. It's not because I some a doctor was telling me that my symptoms I get dizzy when if I read while driving, I immediately get dizzy, or I've been getting like nauseous whenever I go to entertainment parks and I go to on the rides, I get nauseous. I used to get car sick when I was a child, but now it's better. But I tend to easily get those. It's a lot more than, average. When I compare myself to everybody else in the park, I'm the only one getting sick.
Yeah.
So
Yeah.
a doctor was telling me that could be a methylation issue.
Of course.
Um,
Well, this is how I look at fertility. I treat everyone because about 50 to 60% of the population have the MTHFR gene mutation or variant. And so I just treat everyone as if they've got it. So that's
mhm.
why look at your whatever vitamins you've got. If anything that says folic acid, get rid of it.
Yeah,
Just make sure that, when you're purchasing your vitamins, that you have methylated B vitamins. And that way you're getting the activated folate, which is really important.
yeah.
Or focus on folate rich foods, beets and
Hmm.
greens and, all those beautiful things. Yeah, even could be some liver capsules. Beef liver capsules are great. Yeah, high in folate.
Yeah. So I mean, could the IC be related to all these, or that's like,
Absolutely.
yeah,
Interstitial cyst, absolutely, without a doubt. Yeah, yeah. Have you tried acupuncture?
I did. I did it for about 6 months. Um, Honestly, I didn't feel a lot of changes.
Okay.
This, mhm.
Were you seeing a fertility-based acupuncturist?
Yes.
Okay.
Yeah,
All right.
that was the main goal. And I don't know if it was, I just don't know. I didn't feel that in a lot of change. But what he told me, he was also TCM. He
Yeah.
told me about, my digestive issues that I was completely unaware of. He told me your digestion is not there, and your overthinking and stress kind of like gets in the way of digestion. You need to work on those.
Yes.
Don't eat, cold food. Those things really helped, and I started working on everything.
Yeah.
But the acupuncture itself, mm, I didn't feel much, or maybe I didn't notice, but I like the acupressure
Yeah.
points.
Yeah.
I
Great.
think that's something that I'm interested in. I want to start doing those, when
Yeah.
you just tap on your own body. That I like that.
Well, even if you look at the EFT tapping, right? I do this with all of my patients. I talked to this on a podcast just recently. What the podcast host didn't realize is that the EFT tapping is all acupuncture. It's all
Yeah,
this is Chinese.
it's based on
It's
it's
all,
based on
all these,
Chinese medicine.
yeah, it's all these points, and it's been ripped off as, oh, this is the emotional freedom technique. I'm like, no, no, this is
Mm.
Chinese medicine. So
Yeah,
tapping these
they do. When they're honest, they do bring they say it's taken from TCM, but sometimes it's not, just overlooked
yeah,
that
it's
part. But
overlooked.
I knew
Yeah.
I knew that it was from based on Chinese medicine.
Well, when you have issues with the spleen and stomach in Chinese medicine, this is your digestion. These are your
Hmm.
meridians that are associated with your digestive and your microbiome, all right, aka gut health. So what happens is that the spleen is involved in thinking. So if
Hmm.
it's weak, if your gut is weak, then of course you're going to have worrying and rumination. So it makes
Hmm.
sense that, for you, I'd be looking at a gut healing protocol. I'd start there and maybe go back and have some acupuncture and learn the acupressure points like stomach 36, spleen 6, Ren 12. These are all awesome points that support the gut health. And he can show you, or he or she could show you those points. And, if you do have any kind of internal cold and things aren't working, you can even moxa these points using heat therapy. Yeah. Yeah, it's powerful Chinese medicine, and I love these principles. But yeah, it sounds like we need to start with the gut first and
Hmm.
liver clearance. So what happens is if the gut is not working well, then your liver clearance is poor. right? We need a
Mhm.
strong gut so then your liver can clear. So I'd be working on fixing the deficiency and then working on supporting your liver detox pathway. So you can use N-acetylcysteine. That's my number one favorite. You can look at magnesium. I love magnesium glycinate, because it's powerful to support your detoxification pathways. It also stabilizes the mast cells and it helps reduce histamine release. So I'd be looking at, taking magnesium morning and night for you, because it's involved in 300 enzyme reactions. So magnesium and N-acetylcysteine would be two big things that I would use for you.
Mhm.
You're
I
going to
do
get,
take magnesium glycinate at night. I'm going to add the morning dose as well.
yeah.
Um,
If have you done a hormone panel of late? Do you know where your hormones are at? Do you know if you've got estrogen excess relative to progesterone? Do you know what's showing up in your hormone panel?
um, I yeah, I have some test results. But I used Inito for a few months. So,
Yeah.
but based on the test results of estrogen, yeah, the estrogen was in the like 50s,
Okay, it's not overly high.
which was yeah,
No.
and then progesterone was kind of low on the lower side, like it wasn't very it was supposed to be with the progesterone, but
So you could look at,
um
vitamin B6, as I was talking about, because it helps with the progesterone synthesis. You could even look at
mhm,
Vitex, for
yeah.
stabilizing that. Yeah.
And would Vitex be just taken every day of the cycle?
We take it every day of the cycle from the last day of your period. So when you're shedding and when you're bleeding, no Vitex. You need to take a
Mhm.
break from it. So you don't take it through the entire cycle. So stop when you're menstruating.
Okay.
Mm-hmm.
And then, yeah, I did have I have unexplained infertility. The only thing that the doctors could find was low AMH.
Okay.
And it's at 0.14 right now. It was 0.37
Okay.
2 years ago. And then high FSH is in around 20.
Okay, so
Um,
with lowering our FSH, what we want to work on is, especially working on the stress. And, that's what I do like about acupuncture. It lowers FSH. It's my favorite thing for lowering FSH. Boom. Like
mhm,
I can lower FSH in 2 months with acupuncture. It's amazing. So I definitely go back to giving acupuncture a go for lowering that FSH, because we want to see it ideally under 10 or 10 and
mhm,
below. Yeah, when it's up around the 20, we need to kind of minimize that. But this is all your lower diaphragmatic breathing. That works on your FSH. Even
mhm.
magnesium works on your FSH. All right.
What
Yeah.
was the last one?
Magnesium glycinate.
Oh
Yeah.
yeah, yeah.
Yeah.
And you talked about pregnancy loss. I had one.
Okay.
Um, and that was a pregnancy through IVF. So I never had a natural pregnancy, but I had one through one cycle of IVF, but then it ended with loss at week 7. So
Okay.
that, all of the symptoms are kind of
Yeah.
there.
Okay. It sounds like you've definitely got some histamine intolerance going on. And I would start to make it a focus of
Mhm.
this journey. Absolutely. Yeah. Any other questions?
Okay. With the spleen, how can I know that the spleen is struggling? Is
Well,
there like a test that I could do myself,
if you're
or is
looking
it
at
just based on what I said?
if you're
You can
looking
say
at
that.
you're looking at from a Chinese medicine perspective,
Hmm.
or if you're looking at it through the lens of Western medicine, then you could do like GI map testing, stool testing. You could look at candida if there's a buildup of candida albicans in the gut. But from a Chinese medicine perspective, we look at tongue diagnosis. We look at, excessive worry. Sometimes the spleen in Chinese medicine governs the 4 limbs, so you could have like fatigue, low, like limb pain, leg pain, achy legs, excessive worry, because this, excessive worry injures the spleen. Um, yeah, this it's so just you could look at it through 2 different lenses. It's always good to correlate that. So how are your energy levels? How much of an interest do you have in eating? So I often find people when they have spleen qi deficiency that they have, poor diet or not eating frequent meals. So one thing that I'll get you to do when I'm working on fixing the spleen and gut dysbiosis or gut weakness is, is to chew your food like a Buddha, 12 to 18 chews per mouthful. So, and not eating with distraction, not eating with fluids because it dilutes your digestive enzymes. So we don't want to dilute that diamine oxidase enzyme. All right. So when you're eating, you're just eating and you're masticating. So it's important to chew when you eat. So these are all things. So if you're at your computer when you're working, make sure you don't have your meals in front of the computer. Walk outside, work on your cortisol awakening response. So direct sunlight. So then we work on the stress that way. We want to get out in nature, look at, an appreciation of nature, an awe walk. Like all of these things help the spleen. Walk after meals because it stimulates the leg meridians and it helps you metabolize your food. So then we get nutrient absorption. So that's another way to help with the spleen. And then looking at all these low histamine foods. Sweet potato is very spleen friendly. It's the number one food for the spleen. All right. And looking at those omega-3s and, leafy greens because they work on the liver detoxification pathways.
Okay. Sounds good.
You're welcome.
Thank you.
You're welcome, Nudges. Jocelyn or Zoe, do you have any questions for me? Hi, Zoe. Can you hear me? I can't hear you. Maybe turn your volume up on your volume control. I can't hear you. No? Okay. No, I can't hear you, Zoe. What about Jocelyn? Do you have any questions? Any questions? I think, Nudges, we had some great questions there. I think we've answered a lot just there. Hold on, Jocelyn. I don't have any questions. All these things are wonderful. Okay, great. That's brilliant. I'm so happy to hear that. All right, ladies, I'm going to love and leave you. Just know that I am doing these lives weekly, these Zoom meetings. So I want you to feel free to come with your questions, come to listen, come to share your takeaways. But just open, it's an open forum. It's a circle of women and we're women empowering women. So I will love you and leave you. I'll see you next week. Bye, ladies.
Thank you very much.
Thank you. Bye-bye.